Welcome to Southern California EMS Training Institute. This is Taylor. We're going to be talking about lung sounds today, going over how to assess a patient's lung sounds. We're not going to be talking about the different lung sounds, more or less just how to use your stethoscope and then how to assess a patient's lung sounds. So first off, really important is knowing a little bit about your stethoscope. Obviously, this is known as your bell or your diaphragm of your stethoscope. This is what we put on the patient. And then this is your earpieces right here. We want to make sure your earpieces are facing towards your eyeballs or the front of your head. So if you need to adjust them just a little bit, go ahead and make sure they fit nice and well as we're doing that. Another thing we want to look at with our diaphragm is we want to make sure that we're on the correct side. We actually have two different sides of our diaphragm. One is more used for lower pitch noises and the other one's more for higher pitch noises. The one we want is we want the larger side as we're listening to lung sounds, especially in adult patients. So when we're going to listen for lung sounds, what we're going to want to do is we're going to go from right to left, right? And we're always going to want to assess bilateral lung sounds, meaning on each side. So we're going to start up here at what we call the mid-clavicular line, the line right in the middle of the clavicle, about 2 finger spaces down. We're trying to listen in between the rib, in between your ribs, because sound doesn't transmit very well through bony tissue and transmits very well through watery tissue. And so we're going to try to listen in between the rib spaces if we can. So what I'm going to do is I'm going to go ahead and have my patient here go ahead and take a deep breath. And I'm going to move automatically to the next side. Now, it's really important as we're assessing the patient's lung sounds that we listen to the top of the lungs as well as the bottom part of the lungs. Your lungs have different lobes, and so we want to make sure that we listen to the entire lung. The lung is 3D, so we want to listen to the front of the chest. We also want to listen to the sides of the patient's chest and then the back of the chest as well. If you go ahead and turn and just face me. The next spot we're going to listen for is actually underneath the patient's armpit, kind of just right down the side. We call this the mid-axillary line. It's about 4 finger spaces down from the patient's armpit. And so we're going to go ahead and listen bilateral. Deep breath. And then we're going to do the same on the other side as well. And Taylor, go ahead and spin around for me. And we're also going to listen to the back. Again, making sure we listen to the top of the lungs or the apex of the lungs. And then we're going to listen all the way down to the bases of the lungs, getting all of those different lung sounds, listening for all those different sounds we could be hearing. Good. Thank you, Taylor. Go ahead and turn around for me. It's really important as we're listening to a patient's breathing that we're listening to the full cycle of breathing, both the inspiration as well as the expiration. Sometimes sounds can be heard only on inhalation or maybe only on exhalation, and we want to make sure we're listening to all of those different aspects of the breathing or all those different parts of the breathing. One other thing we want to note about lung sounds is we want to note all of the patient's lung sounds. If I'm having a patient with respiratory distress, I want to assess all over my patient's chest to really get a good picture of what my patient's lungs sound like. It's best to do this in a quiet environment, somewhere where you can hear it very well, and it's best to not do it over clothing if you can't, if you don't have to, because the clothing will impede a little bit of the patient's sounds. A thin t-shirt or something like this would be okay or appropriate, but any thick clothing like jackets or things need to come off before auscultating a patient's lung sounds. That's how to listen and assess patients' lung sounds from Southern California EMS Training Institute. Thank you guys very much.